Okay, the hyoid bone is actually located underneath the chin. It's what they call a U-shaped or horseshoe-shaped bone. It does not articulate with any other bone. It supports the tongue as its function. It provides attachment sites for some of the tongue muscles, muscles of the neck and the pharynx, and it helps to keep the larynx, the voice box, open at all times. Your vertebral column is also called the spine backbone or spinal column. It functions to protect, of course, the spinal cord, supports the head, also serves as a point of attachment for the ribs, pelvic girdle, and the muscles. Um, it is a curved column, so it varies in degree from different locations. So the curves increase the column strength, so helps to maintain the balance in upright position, helps to absorb shock during walking, and help protect the vertebra, of course, from fracture. This is showing you a picture of the vertebral column. One thing to note on here that you do have 7 cervical vertebra, 12 thoracic vertebra, 5 lumbar vertebra. So I always tell students, to help to remember those in order. You normally eat breakfast at 7 a.m., lunch at 12 noon, and you normally eat dinner at 5. So that's kind of because you do need to be able to tell me that you have 7 cervical vertebra. You'll need to tell me that the C1 is the atlas, C2 is the axis, and you can see that they're all numbered, and the cervical will be C1, C2, C3, C4, C5, C6, C7. Okay. For the thoracic, it changes to T1 through T12. Okay. And just remember, you have 12 thoracic vertebrae, you have 12 ribs, so they articulate with the ribs. And then, of course, you have 5 lumbar vertebrae. You do have 1 sacrum and 1 coccyx, which we'll talk about these in detail in the next few slides. Next, vertebral column. So you have various conditions that may exaggerate the normal curvature of the vertebral column. Kyphosis, this is of course when they have an increased thoracic curvature here of the vertebral column. Lordosis, so this is when you have an increase, of course, in the lumbar curve of the vertebral column, because it kind of goes more inward. Scoliosis, of course, is when you have a lateral bending of the vertebral column. It'll bend over to one side more than the other. So vertebral column is composed of a series of bones called vertebrae. And you have 26. You do need to know that number. 26 vertebrae total. Know that you have 7 cervical, 12 thoracic, and 5 lumbar. Okay, of the cervical region, a few things that you need to know. Of course, cervical regions, we're going to refer to the neck region. They are labeled or numbered C1 through C7. Okay. The first 2 have names because they have some special features. The C1, of course, is called atlas, and it's going to articulate with the occipital condyles. Okay. It also, of course, this one, of course, allows you to move your head up and down in order for you to say the word yes. And this one, actually, when we look at the actual anatomy of the vertebra, this one has no body. Okay. C2 is the axis. This one, of course, allows you to shake your head side to side in order to say no. Okay. It has what they call a Dien's process, also known as your odontoid process, that fits into the atlas, and it allows a pivot action, and that pivot action allows you to move your head side to side and say no. Posterior to the thoracic cavity, you have the thoracic is vertebrae T1 through T12. These are the ones that are going to articulate with the ribs, so they have a special feature on all those, and it's called a rib facet, and we will look at that when we look at the anatomy of the vertebra. Lumbar region, they just have the typical structures. They support the lower back. They're going to provide it for the attachment of the large back muscles. Next, you have the sacrum. It is a triangular bone. It is formed by the union or fusion of 5 sacral vertebrae, and they used to be called S1 through S5. Now it's fused together and it is one sacrum. So it serves as a strong foundation for the pelvic girdle. You have one coccyx. It is also triangular shape. It is formed by the fusion of usually four coccygeal vertebrae, and the coccyx is also known as your tailbone. Okay, this right here is just showing you the same picture I showed you previously. It shows you the back curvature. But just to let you know that your back, of course, curves at usually around the age 4 to 5 years old. Vertebral column with the referring to the intervertebral discs. These are discs here. You look on the picture here. They're found between the adjacent bodies of your vertebra. So this is your vertebra one, here's another vertebra, and here's another vertebra. And the gray area in between here, these are going to be your intervertebral discs. So what they do or how they function is they form strong joints. They're going to permit various movements of the vertebral column. They're going to also help absorb vertical shock. So the intervertebral discs, they have an outer lining that is made up of fibrocartilage. The inner lining is composed of what they call nucleus pulposus. And when that nucleus pulposus oozes out, it's called a herniated or a slip disc. Okay, this right here is just showing you those vertebrae together, and it's showing you, of course, the intervertebral disc here, and shows you just a little bit more enlarged. Then, of course, here's one vertebra, and here's another vertebra. We'll talk about how they articulate together. So this one right here is showing you a normal intervertebral disc, and this is showing you one that's compressed, what it looks like. You can see it kind of bulge out a little bit here. Vertebra, of course, typically consist of a body, of course, and that's going to be this little section here. Okay, and that's the weight-bearing part of the vertebra. It also has a vertebral arch, and your vertebral arch, of course, is through here. And also, of course, you have your several processes. So you have your one process here, and this is called the spinous process. And you have two on the sides for transverse processes. Okay, so if you look here, what I've done is I've made a chart up because you do need to be able to locate these typical body part, thoracic vertebra parts on each vertebra. So if I'm going to put it like a little red dot besides the ones that are typical that they all have, and you can see that they're all in all of them. They all have a vertebral foramen. Some books will call that a spinal foramen. Transverse process, they all have that. And of course, the spinous process, they all have that. They all have the articulating surfaces. And the articulating surfaces, and we'll go over this on the next few slides with the pictures, but these are called superior if they're on top, articulating surfaces, or if they're on the bottom, they're called inferior articulating surfaces. And I'll abbreviate articulating surfaces AS. So they are two superior, depending on where the position is, if it's above or below. Okay. But if you notice here, you have a special structure with the cervical vertebra. Again, you have the C1 is called the atlas. It has no body on it. It allows you, of course, to shake your head. Yes. The C2 is the axis. It has a dens process or odontoid process. It allows a pivot motion. It allows you to shake your head no or side to side. Okay. Typical cervical vertebra have a transverse foramen on them. So that's one special structure of the cervical. With the thoracic, the one special feature it has that the other two do not have is that they have rib facets. So if you remember, you have 12 thoracic vertebrae, you have 12 ribs. So the ribs are going to articulate with those thoracic vertebrae. So they have what they call rib facets. Okay. So So here again is a video. If you pull your PowerPoint up in presentation mode, you should be able to play the video. It will not let me play it on this portion where I'm recording it. Next we have here showing you the cervical vertebra, of course, articulating with each other. It's showing you, of course, this is your this one right here, of course, is going to be your C1. And it don't have a body. This is your C2. The C2 has this DENS process here. So it's kind of showing you that. And then it's showing you, of course, how they articulate with each other. And here's where they articulate. Okay, again, this right here, of course, is showing you the atlas and a typical vertebra of the cervical. So this is showing you the atlas, and this is just a typical one. Okay, but this one just shows you because the atlas has no body. Again, also to remember your atlas allows you to shake your head up and down, so it allows you to say yes. Okay. They also showing you that this particular cervical vertebra has the transverse foramen. So these are the openings here. Okay, those those are what they call the special feature for the cervical vertebra. They're going to be the transverse foramen. Also, too, things that you should be able to label, and I will highlight those. The pedicle, of course, is this area here. The superior articulating surfaces. Be able to, of course, label the vertebral body, the transverse foramen, transverse processes, vertebral foramen, spinous process, and the lamina. So on the C1 and the C2, I just make you know the special structures, and then I make you label everything on the typical vertebra. Again, this one, of course, is showing you the axis. And remember, the special structure it has is the DENS. Okay, and remember the DENS allows the pivot motion of the head to shake your head side to side, so it allows you to say, of course, no. Okay, again, here is a video showing you the features of the atlas and the axis on using models. So you can watch this after you watch this recording. Again, this is showing you, of course, your thoracic, of course, vertebra. You don't have to label this picture, but it just shows you, of course, how they articulate, of course, with each other. So if you look here, I want to show you the superior articulating surface or facet. One is going to articulate with the inferior one of the other one. So see, here's the inferior of this one, the superior of this one. So you can see how they're articulating together here. Okay, this right here is showing you a typical thoracic vertebra. They say when you're looking at it facing this way, it looks like a giraffe's head. Okay, so that's just something to remember when you're in lab looking at the bone models. But you do need to be able to label the transverse process, and that's this process here. On the back side of it is the rib facet. Then we'll change the highlighter just so on the back side, that's going to be the facet, of course, for the tubercle of the rib. Okay. So you do need to be able to label the pedicle, which is this area here, the lamina, which is this area on this side, Be able to label the vertebral foramen, the body, and that's pretty much it on this picture. Oh, and the spinous process. Almost left it out. So this is showing you the thoracic vertebra from an angle. So we look in here, you can label the transverse process. And again, these few slides on the vertebra are going to kind of be repetitive because they all have a lot of the same features. They just may look a little bit different as the vertebra moves down the spine. Okay, but the facet for the articular part of the tubercle of the rib, which is also called the rib facet, of course, is there. Um, and just remember that that rib facet is found only in the thoracic vertebra. So some things you need to know is, of course, the head of the rib articulates with what we call the rib facet of the vertebra. And that rib facet, of course, is on the back side of the transverse process. And then, of course, on the tubercle portion of the rib, it's going to articulate with the body of the vertebra. And of course, the body of the vertebra portion would be, of course, right here, the superior facet here. Again, here is a video showing you about the thoracic vertebra in particular, so make sure that you, of course, watch that when you pull up the PowerPoint. Again, this picture right here is just showing you those intervertebral discs that we've already talked about. Remember, the intervertebral discs are going to be between each vertebra. They absorb shock. It's going to allow movement of the vertebra. It also is going to help to form strong joints between the vertebra. And just remember, the vertebra, of course, they also change shape as they move down the vertebral column. This shows you that a lumbar vertebra, and of course it has all the typical features. It doesn't have any special features other than how it changes shape as it moves down the vertebral column. But be able to label the transverse process, the vertebral foramen, some books will call that spinal foramen, the body, pedicle, lamina, spinous process, and this is showing you the superior articulating surface. Okay, here is showing you the lumbar vertebra from a side view or the right lateral view. Just remember, they also say when you're looking at this vertebra from the anterior or this side, it looks like a moose's head. So we'll show you that when we get into lab, and maybe the video probably showed that as well too. It just shows you, of course, the same features. Again, another video to watch on the lumbar vertebra. I incorporate these pictures into the PowerPoint because I like how they show the parts of the vertebra in different colors. So these are your articular processes. Okay, the part this is where they have their superior and inferior articulating surfaces. So the smooth part of those are going to be the articulating surfaces. The roughened parts are called the process. This is, of course, the vertebral arch, and then this whole section here is the body. Again, this shows you, of course, the spinous process, the lamina, transverse processes are on the sides, then the pedicle is going to be this area here. This right here, you don't have to memorize this picture, but it does show you shows you a comparison of the major structural features of the cervical, thoracic, and the lumbar vertebra, and how they change shape as they move down the vertebral column. So you can look over that. So the smallest one will be cervical, then larger would be the thoracic, and then the largest would be the lumbar. Okay. Um, so you have with the foramina, you have one vertebral and two transverse. You have one vertebral in thoracic and one in the lumbar. Okay, so you can kind of read through these, but it shows you, of course, if things are absent or present in each. But I give you a separate chart with that same information on it. So the sacrum, of course, is fused by the union of 5 sacral vertebrae, and between usually age 16 and 18, it's completely fused together, of course, or completed by age 30. The coccyx, of course, is formed by the union of usually 4 coccygeal vertebrae, and it occurs between the ages of 20 and 30. Remember that the coccyx is also known, of course, as your tailbone. Okay, so things to know about the sacrum. Of course, you have the body, uh, and this right here is calling it the base, but also the body here of the sacrum. You have the sacral foramen, which is here. Remember, the sacral foramen are going to serve as passageways. Transverse lines, the transverse lines are like right here, 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 and here. These transverse lines, what they were is they're where the vertebra bodies were at, but are now fused together during the formation of the sacrum. The sacral articulating surfaces, this is where you have the subbooks will call that, of course, that's showing you what's with the articulation with the hip bone right here on each side. But some books will call that sacroiliac. Articulating surface. So you may hear it called that. Another special feature that you need to know, I left off here, is the sacral promontory. Let me change pins. That's this little section here. Okay, so the reason why that's important is because that shows a landmark in females during like a pelvic examination and also during labor and delivery. So that's an important landmark. Next, you have your superior articulating surfaces located here. These, of course, you're going to articulate with your L5. Or your lumbar vertebra 5. The median sacral crest are down the middle here. The median sacral crest used to be the spinous processes of the vertebra, but now they're fused together to form that median sacral crest. So when they form the sacrum. Sacral canal is the opening at the top, and of course the sacral hiatus is the opening at the bottom. But that's just the proximal and distal openings. Again, once you have time, please go back into the video and play the video on the sacrum and the coccyx. Some checkpoint questions. If you want to pause this before I answer them, you can do that. But what are the functions of the vertebral column's intravertebral discs? And remember, those discs are going to help form strong joints between the vertebrae to permit various movements of the vertebral column. Also, it's going to help your vertebral shock. What are the 3 main parts of a typical vertebra? The 3 main parts, remember, are going to be the body, the arch, vertebral arch, and then several processes. So your thoracic entire chest cage is formed by the sternum, which is the breastbone, and that's a flat narrow bone, the ribs, the costal cartilages. Costal cartilages is made of hyaline cartilage, and it's attached to the sternum, elasticity of the thoracic cage. You have the 12 thoracic vertebrae that are attached to the ribs, articulate with the ribs. They function to enclose and protect the organs in the thoracic and abdominal cavities. They're going to provide support for the bones of the upper limbs, and they're also going to play a role in your breathing. The sternum, of course, serves as an attachment as well for the ribs. So it is a flat, narrow bone. So the breastbone, of course, is located in the center of the thoracic wall. It consists of the manubrium, the body, and what they call the xiphoid process. So the manubrium, of course, would be the upper portion here, the body, and then, of course, the xiphoid process. So make sure that you can label those three parts. The xiphoid process, this is one that can be easily broken off during CPR, but it can be injured during CPR. But it can re-heal itself. Okay, you have 12 pairs of ribs, 1 through 12. They are going to give structural support to the sides of the thoracic cavity. And if you notice here, each one of those ribs are numbered 1 through 12. So if you go through here 1 through 7, okay, those are called true ribs, and it's because they're directly attached to the costal cartilage that goes to the sternum. Okay, 8, 9, and 10 are indirectly connected. So what they do is they come up here and form and join in at 7's cartilage, and then goes to the sternum. So they're considered false ribs. Those ribs are attached indirectly or not at all to the costal cartilage, because 11 and 12 is not attached at all. Okay, so I tell students all the time, you have your 8, 9, and 10 are false ribs. 11 and 12 are false ribs, but they're also floating ribs as well too, because they are not attached to any costal cartilage at all. And this picture just shows it to you up close, those ribs. Okay, and then I just like to show you where the 8, 9, and 10. This cartilage comes in and joins in with 7's cartilage, so it's indirectly attached. So those are false. 11 and 12 has no cartilage on them at all, so they're both considered false and floating ribs. Here is, of course, the rib. And of course, you need to be able to label the head, which is the end piece here, the neck, and then, of course, the tubercle. Okay. And the reason why you need to know those is the head, of course, it articulates with that body of the thoracic vertebra. And the tubercle, remember, it articulates with the rib facet on the thoracic vertebra. And the neck, of course, of the rib is going to, just provide support. And then the rest of it, of course, is considered the body. This right here is showing you that connection. So it shows you, of course, that tubercle right here, tubercle of the rib, is articulating with that rib facet. Remember, the rib facet's on the back side, of course, on the side of the transverse process. Okay. And then the head of the rib is going to be articulating with the body, which you can't really see in that angle of the picture. This angle you can see a little bit better. So you have the tubercle, you see it articulating with that rib facet here. Then you have the head, of course, of the rib here, articulating with the body of the thoracic vertebra. So what bones form the skeleton of the thorax? It's going to be your sternum, manubrium, body, and xiphoid process, and then also the ribs. What is a herniated or slip disc? And that's when the nucleus pulposus may protrude out due to injury or weakened disc and pressure associated with it. Spina bifida, this is where you have a congenital defect of the vertebral column in which the lamina of the L5 and the S1 fail to develop normally and unite at the midline. Chiropractor, of course, that's a holistic healthcare that focuses on nerves, muscles, and bones. And they're concerned, of course, with diagnosis, treatment, and prevention of like the mechanical disorders of the nervous system and health in general. Whiplash, that is when someone has injury, of course, to the neck region due to severe overextension in either direction. It could be a hyperextension, which is backward tilting of the head, followed by hyperflexion, which is forward tilting of the neck and too much. Defined spinal fusion is when you have surgical procedure in which two or more vertebrae of the vertebral canal are going to be stabilized with a bone graft or synthetic device. Okay, and then I'll play another video on the other part, or maybe one or two videos.